Welcome to The Other Side, Mississippi Today's political podcast. I'm your host, Adam Ganishow. The Other Side lets you hear directly from the most connected players and observers across the spectrum of politics in Mississippi. From breaking news to political strategy to interviews with candidates and elected officials, we'll bring you facts, perspectives, and context that helps you cut through the noise and understand all sides of the story.
Welcome to The Other Side, Mississippi Today's political podcast. I'm here today with my colleague, Geoff Pender. Geoff, how you doing?
Hey, Bobby.
And we have with us today Richard Roberson, Chief Executive Officer, President of the Mississippi Hospital Association. How you doing, sir?
Hey, I'm great this morning. How are you guys?
We're doing fine. We're happy. We're pleased that you're with us today.
Thank you for having me.
Before the holiday. And just for background, Richard served as General Counsel for the Hospital Association before he became, and then he headed True Care, which is a insurance company, I guess, sponsored by the hospitals. Is that
formed by a bunch of Mississippi hospitals that got together to form a health insurance company to try to make a difference in how health care is delivered? Yes, sir.
And then Geoff and I, we first met you when you were at Division of Medicaid.
Way back in the day.
Yeah, way back in a long time. You were General Counsel. You were, I guess, Chief of Staff. You pretty much was the go-to guy in terms of knowing what was going on at Medicaid.
Well, it was a great team working under Governor Barber for sure.
Well, and we appreciate you being here today. There's a lot going on in healthcare in Mississippi.
Yes, sir.
And the legislative session is coming up. I mean, what can we look for in terms of what the Hospital Association hopes to accomplish this legislative session? I know y'all have some issues in terms of viability. Not viability is probably the wrong word, but just sustainability of some of your smaller rural hospitals, and I guess even some of the bigger hospitals are struggling. Right. What do you hope to see in the legislative session in 2025?
Well, we've got a lot of things going on with our hospitals. Everything from issues such as cybersecurity. I'll start with that one. A lot of people don't necessarily think about cyber attacks as being a big deal, but they have become a big deal for healthcare. And so we're working with some other groups across the state to look at best practices on cyber security, but then also protections on liability on the back end, so that if a hospital has done everything they needed to do to stay safe, they're receiving some liability protections, because it's hard for these hospitals to go after the actual perpetrators of these cyber attacks when they're located in foreign countries that are hell-bent on doing bad things in the United States. And so that's been a big issue. So we're going to look at tackling that. We're going to look at some changes, very strategic changes, very thoughtful changes in the Certificate of Need laws, some things that will help reduce the cost of health care. And I would say, with that said, Mississippi hospitals are the lowest cost hospitals in the country. It's really not even close. We're a couple of $100s a day per day cheaper than the other hospitals across the country, and we don't sacrifice quality for that. We rank kind of right in the middle on quality, so we're the lowest cost, but we're doing pretty good on quality scores too across the country. So we're going to look at some things on CON that we think can make a difference.
Before you go any further,
yes, sir.
Everybody, I sometimes assume everybody listening to our podcast knows it's kind of, or in the know on such issues, but explain what a CON, what a Certificate of Need is.
Yeah, so CON
in 25 words or less.
Yeah, well, and I'll try to do that. So CON is basically a planning tool for the state government, in our case, to plan the distribution of healthcare resources in a way that is cost-effective and efficient. And they started back in the 70s, and most states still have some form or fashion of CON laws in place. And essentially what they do, because the government is such a significant payer for healthcare services between Medicare and Medicaid and TRICARE, the government needs to be involved in deciding where services are placed and how much we're paying for those to try to keep costs down. And I would say in Mississippi, having these CON protections has enabled us to keep the costs down. Because if you think about how economics typically work, when there's a high supply of something, or a high demand for something, the costs are going to go up. Well, we've got a high demand for healthcare services in the state of Mississippi because we got a really sick population, and we typically lead the country in all the things you don't want to lead the country in, which are things like heart disease and diabetes and obesity, and so we've got high demand for healthcare services. But on the flip side, our costs are pretty dang low. So I think CON is working, but it's a tool that the government has had in place for years, which just kind of helps with the distribution of healthcare and also helps weed out potential fraud, waste, and abuse. Because if you've got to go through a process to provide these services in some cases, then typically if you're a bad guy, you're probably not going to go through that process. So we do have, compared to other states and other parts of the country, a pretty good handle on fraud and abuse in Mississippi. Every now and then something pops up, and it can be bad, but for the most part we do a pretty good job. So CON helps protect with that.
Richard, somebody explained to me CON way back in a way that sort of made sense, is that the government intervention in this prevents companies from in a particularly in a rural area or somewhere coming in and offering nothing but plastic surgery because that's the most profitable, or pick another service and then not offer anything else, no emergency room or whatever.
Right.
Of course, this also becomes a battle between people wanting the free market to be more in control of and competition, as the governor's talked about. But there's some kind of balancing act there, isn't there?
There is, and courts have looked at certificate of need laws in various states, and there was a court case a few years ago out of Virginia as a federal court case that went to the Fourth Circuit Court of Appeals, and they recognized in that case that healthcare is not a free market because you have such a government payer influence between Medicare and Medicaid, and there's such a significant government interest from what our military folks pay through TRICARE, through what Medicaid pays, through the state and federal government payments that are involved with Medicaid, and then the federal program Medicare. Lots of government interest in healthcare. Government is your primary payer. And so they have an interest in making sure that the healthcare resources are fairly and evenly distributed, and that you don't have cherry picking, and you don't have folks that just come in and prop up a single type of service that then siphons off more profitable customers, which unfortunately do happen every now and then. But if CON, if done right, which I think we've done a good job in Mississippi, can keep the cost down and also allow access to care. Our primary reason in areas of the state that struggle for access to care is they struggle for revenue. They're typically going to be in higher poverty areas of the state, and it's just not where the revenue is. That's really the single biggest challenge for services expanding across Mississippi. It's just the payers aren't even there, and so you may not even have a significant Medicaid presence, much less a commercial presence. And so revenue drives a lot of the distribution and the location of healthcare services. Parts of our state that are more affluent, you're going to see a lot more opportunity for healthcare providers. Those are where providers will go because they know they can get the reimbursement for their services.
You mentioned maybe some changes to CON. I know there's been reluctance to even bring it up because of that bigger battle, competition and free market. What are some changes you think can be done that would not?
Well, for example, right now there's a threshold of $1.5 million on major medical equipment. So if someone's looking to add some new technology, if it exceeds $1.5 million, they have to go through a certificate of need process and apply, send in an application to the health department. The health department then has to review it. They're charging fees for their time and resources that they spend. Typically, you're going to have a lawyer that handles that application for the hospital, in our case, that may be seeking that additional piece of equipment. So it adds tens of thousands of dollars to the process just simply to allow for that provider to get the latest and best technology for their patients. So we're looking at increasing that cap from $1.5 million up to perhaps as high as $3 million just with an inflationary adjustment. That $1.5 million was put in place back in 2016, and everybody knows what's happened with inflation.
Especially
over the last
inflation.
9 years, especially healthcare inflation post-COVID with cost of equipment, supplies, and labor and supply chain issues. And so, if all you're looking to do is to improve the services and the equipment that you offer to your patients, then we want to make that easier.
Now, I apologize. I veered you off course by delving
you're great.
Delving in the CON, but you were talking about, I think, some other issues related to the 2025 session. So
we're going to look at some other issues. Strengthening the healthcare workforce is continuing to be a big challenge, and we want to do everything that we can do to educate our young folks to get into healthcare careers. Obviously, doctors and nurses are super important, but there's some other great jobs in healthcare, and we're short on those jobs. Respiratory therapist, physical therapist, speech therapist, other forms of providers. And then folks that work in the labs, folks that run your clinical lab test. There's lots of opportunities in healthcare. They're great paying jobs, and they're highly needed and very much in demand. And so we want to create a pipeline not just for physicians and nurses, but for all of these different folks that are needed, that are part of in the hospital's case, part of a larger team that takes care of our patients. And so we want to create those pipelines as well. So we'll be talking to the legislature about workforce programs that can help in all those. We, from the part of MHA, are also looking at things that we can just do ourselves to help with that. So some more to come on that. And then, of course, Medicaid and Medicaid expansion has always been an issue. It's the single biggest thing we could do for the Mississippi economy and for the state of Mississippi as it relates to health care. We could cover, a couple 100,000 people perhaps, maybe more, depending on what the economy looks like. Better economy typically has lower Medicaid enrollment. If the economy goes south, then you typically see the Medicaid enrollment go up. But what we're talking about with Medicaid expansion is really just providing coverage to able-bodied working adults that are not otherwise eligible for health insurance. They may be working in a job, they may be in construction, they may be in retail, they may be in the hospitality business, working at hotels or restaurants. And these are all people that we interact with every day. And they may not be able to either afford or be provided health insurance through their employer. And it's critical that they're healthy. And what we know is that when you have access to care sooner, preventive care, or just getting primary care services sooner, you tend to have a higher quality of life. You tend to be more productive. And so we're hopeful that the legislature will pick up where they left off last year, which was a conference report that had work requirements in there. With the Trump administration coming online, President Trump in January of 2020 put out kind of the Trump administration version of a Medicaid expansion program, and it included work requirements. It included things that I'll just say are Mississippi core values, things like going to school. If you're a college student, this program could apply for you. And if you're taking care of a loved one, a small child that's not school age ready, or a loved one, if you're a caregiver for maybe an elderly parent or someone else in your household that you're staying at home to take care of, but by doing that you don't have access to insurance yourself, this program could work for you. And so all those things that were described in a waiver called the Healthy Adult Opportunity Waiver that came out in January of 2020, we could align very closely to where the legislature left off last year. And nobody really thinks much about that waiver because it came out in late January of 2020, and about 2 weeks later, the first COVID patients were showing up on the West Coast.
Yeah.
So, everything else in healthcare kind of took a dramatic shift. But we do think there's some similarities there that could work and that would be good for Mississippi, that could limit the budget. There's provisions in place to essentially limit the amount of money that's spent on this program so that you're controlling the cost, which I think is fiscally prudent also. And it again can reflect some of the Mississippi core values where we're trying to help people help themselves. And I think that's very doable.
And without negatively impacting the healthcare exchange? I know that was a big issue towards the end of the debate.
Yeah, so and one of the things about the healthcare exchange that that's important to know is that those subsidies for the healthcare exchange expire at the end of next year, and so right now the healthcare exchanges are working pretty well, and folks are getting the subsidies, and that helps with premium costs. It helps with other cost sharing provisions. The the concern with that is if Congress doesn't reauthorize those subsidies, then they're going to go away in about a year. So, I think we need to look at that. I think there need to be some conversations as to whether or not we continue to look at the exchange in the same way they did during the session last year, because there might be a more affordable way. If the state of Mississippi stepped into the shoes right now and provided those subsidies, it would be really, really expensive for Mississippi and a much more expensive alternative to Medicaid expansion than it would have been if we had done the conference report last year.
Yeah, people, I know this has been said a million times, but it's worth repeating that with Medicaid expansion, the federal government would pay 90% of the cost under the current program, and then Mississippi would get a substantial bonus for expanded Medicaid of near
another 5%.
Yeah, around $700 million over a couple of years. So
that's right.
And the subsidies, the enhanced subsidies go away, but there'll still be subsidies for in the exchange, much smaller. But I've had hospital administrators tell me that even with the expanded subsidies that are in place right now, Medicaid expansion still is a better bargain from them than the exchanges are.
From what we've looked at, it's just the 90-10 match and the things that you would do through Medicaid expansion, whether it's what I would just call wide open Medicaid expansion or a more tailored approach through a waiver that reflects some of these Mississippi core values I talked about. Those are all federal matching funds. So it helps defray the cost, but even with that, there's better ways to defray cost and worse ways. And so we're already paying for this across the country. Our federal tax dollars that we're paying are going somewhere else, and it's affecting our ability to provide the best healthcare services we can provide and to attract more healthcare workforce. Because if you don't grow the revenue, you're going to struggle to attract workforce. You can't pay for them. And so no money, no mission type of thing. But, the supplemental payment program that the Division of Medicaid implemented back in September or announced back in September of 2023 and implemented several months later has made a huge difference. Hospitals pay an additional couple of $100 million in taxes each year to fund those payments. And so the hospitals are paying for that out of their own pocket, which is fine because they recognize they're getting return on their investment. And, the return on that investment is not nearly as great as the return on the investment of the state share and federal share ratio that would come under Medicaid expansion.
Yeah, you said that we're already paying for it through our taxes. Since Mississippi's paying for it twice because we're paying our taxes for Medicaid expansion, then the hospital, like people with private insurance, I think you may deny it, but I think it's fair to say that healthcare providers in Mississippi charge a little bit extra on the private insurance carriers to make up for the literally billions of dollars of uncompensated care you guys.
Well, there is some truth to that, Bobby, because the healthcare world has certain fixed costs that have to be covered, and those are maybe whether it's repaying the cost of student loans that a healthcare worker is coming out of school with, that they've got to figure out a way to repay that, or salaries and labor or cost of food and equipment and supplies in a hospital. Those are certain fixed costs that just have to be met. And so if you're not able to make those ends meet through payers that you really don't negotiate with, because you're really not negotiating rates with Medicare or Medicaid, those are the government setting those rates, and TRICARE. From a hospital perspective, almost 70% of our patients are covered by either Medicare, Medicaid, or TRICARE. And then you typically throw in another 8 to 10% uninsured. So about 80% of your payments are kind of already established. And then the other 20% is the commercial payments, and that's where you get a little bit of an ability to negotiate, but not much. And so you're trying to to make ends meet with that. I will say this: a lot of people don't realize this, but Medicaid, with that enhanced supplemental payment that the governor and the Division of Medicaid announced in September of 23, with that, Medicaid has become, in many cases, your best payer, even better than or as on par with your commercial plans,
Wow.
because that's what that program was about. It was a program that Louisiana had just been approved for. It was a program that actually the Hospital Association had went and talked with legislative leadership with in September of 22. Medicaid had been working on it, but then what happened was the Fed started approving a different methodology, even than what they had approved just in that 1 year kind of interim. And so that allowed that program to basically blow up on steroids, which was great. It was also a significant tax increase for hospitals, but the return on the investment because of the matching funds made it worthwhile to do that. But that has made a big difference for hospitals. It does not necessarily mean individuals who need preventive care sooner are getting that care sooner. What we're still seeing are folks showing up in the emergency department or going without care because they can't pay for it. And then that leads to a worse quality of life.
Yeah, the program sends money to the hospitals, but it doesn't send it, and it doesn't
cover
cover those people you referred to earlier.
That's right. It helps offset the cost for hospitals, and it helps offset the cost for the things that aren't paid for with hospitals. And so that's been a significant lifeline for the hospitals, and we're very grateful for that.
Yeah, if the people had Medicaid expansion, they might go to a private doctor instead of going to the emergency room for their
That's right.
They got real sick.
That's right.
Richard, this is really, really backwards, something we should have done at the outset here. But tell us a little bit about your group and who you represent, who your membership is. And I know we've seen some news on that front here recently.
Yes. Well, so, we've got over or right around 75 hospital members. We're really pleased to have our great staff in our building that for many, many years has been there helping hospitals. While we certainly do lobbying activity on behalf of our members, we're not a lobbying firm trying to be an association. We're an association that happens to do some lobbying, and we do education, we do quality, we do workforce, we do a lot of different things for our hospitals.
You guys help hospitals with what software to use, and
we have
that.
business partners that we vet that come to us and ask for introductions to hospitals. But before we do that and kind of give a seal of approval, so to speak, we kick the tires, and we try to find good partners for our hospitals to work with. Whether it's insurance products, things that hospitals buy anyway, we try to find them good partners, and we've done that very well for almost 100 years. And what MHA has been about for almost that whole 100 years has been about making sure that we get our members in the best place they can be so that they can serve their patients. And I like to go back and look at some of the old records from MHA meetings that happened in the 1930s and 1940s, and it was said back then that your hospital derives its reputation primarily from the patient and secondarily from the family and friends that visit the patient in the hospital, and that they may not know about their treatments and the scientific methods for what's being required to get them well, but they know if the food was good and if the linens were clean, and they were treated like a real person and not like a number. And and I'm proud to say that 9 out of the top 11 hospitals in Mississippi are MHA members, and so they're leading with excellence, they're leading with quality, and again, we're the lowest cost hospitals in the country, so we're doing a great job, and we're really excited about that.
Now, but I think Geoff kind of referenced it, but there is another group now. Back
just recently formed.
Yeah, back during the 2023 election, Governor Reeves, who was running for re-election, there's no secret he's probably of the 3 top leaders, he's the most adamant political leaders in the state. He's the most adamantly opposed to Medicaid expansion. and y'all were for Medicaid expansion, and that caused kind of a rift. I mean, you may correct you may disagree with the way I'm presenting this, and feel free to jump in and correct me. But now there's a group of hospitals that have formed a different not association's the wrong word, a different alliance, I guess, who are no longer members of the hospital association. And what do you see as the dynamic of that happening, and especially in terms of Medicaid expansion, the legislative session, and healthcare? I mean, I think that's the main thing in terms of how does this affect healthcare in Mississippi?
Well, again, and I don't lose a lot of sleep thinking about all that. I'm focused on what we're trying to do for our members who want to be a part of an organization that's been supporting excellent things for hospitals and our patients for almost 100 years. That wasn't, just formed for whatever political reasons or whatever other reasons may have been in play there. But so what we're focused on is continuing to provide that excellent service to our members, not just advocacy, not just lobbying services, but education and quality, and helping them make good decisions and bringing good partners to the table, and finding solutions, frankly, for the things that they need to do to serve their communities. And that's what we're going to continue to be about.
Well, let me put you on the spot. I'm sorry. Do you think that with these two different groups, do you think that may have a negative impact on Medicaid expansion debate during the upcoming session, or is it just?
I don't know. I don't know. If that other group's going to take a different path and lobby for something, that's not in the best interest of those hospitals. Many of those hospitals for years have supported Medicaid expansion. For the life of me, I wouldn't know why that would not still be the case, because there's still a need out there for that, both economically and just, if nothing else, to alleviate human suffering, and to allow people to have options, and again, to do it in a way that reflects Mississippi core values. And that's what we're supporting. I mean, from MHA's perspective, we obviously want the best program that is the most beneficial to the state of Mississippi, but we also realize it's something that has to be passed by the legislature. So you got to look at the votes, and you got to think through what and consider what everyone in the legislature is willing and able to do, and where they're coming from, and what their perspectives are, and there's a value in that deliberative process. And there's a value in vetting it in a way that makes sense and that everyone can get on board with, or as many people can get on board with as you need to pass it. And then let's put something in place. I would rather not give up an opportunity to cover another 60 or 70% of these folks that are out there working than to sit around and wait for something that's perfect to cover 100%. I don't think that's fair to throw the baby out with the bathwater. So if we can get back to some serious conversations about covering as many people as politically we're able to get past, then let's see how it does. And I think the conference report is a good starting place. I think the House bill last year talked about it in terms of a pilot program where you would have reporting requirements and you would measure this thing to see, is it doing what it said it was going to do? I think that's fair. After 4 years, if it's not doing what it was supposed to do, and improving healthcare outcomes, if it's not doing things through the Medicaid managed care program that aren't being successful in delivering services, then let's go a different route. But I think there's too many lives and too much money at stake to not give it a try. As much money as we throw at a lot of other different things, both from a federal government and from state government, we can certainly give this thing a shot, and let's just see if it works. And if it doesn't work after a few years, legislature can pull it back.
That group of hospitals that left the MHA and forming their own group consists of some of the larger hospitals. Are we seeing, or are we going to see, a divergence in interest between larger, more urban hospitals and the many, many rural hospitals we have? Or do they still share a lot of the same issues, problems, concerns?
I was meeting with one of our members yesterday, and they recognize the importance of the rural hospitals, and I think they're incredibly smart and thoughtful in how they approach that. And they were saying, look, we want our rural hospital. They're a large hospital. And they said, if we didn't have rural hospitals, then we would have all the patients coming to this hospital here in Jackson, in this case, and that's fine. We want to be able to serve patients and all that, but that's not the best thing for the patients. That's not the best thing for the community.
They're having to travel.
Right. We want our rural hospitals to be successful. We realize that they need to be. And honestly, for, again, going back almost 100 years, MHA from its earliest days recognized the importance of small rural hospitals. And you can see that in the minutes of our annual meetings from way back in the day, talking about how while small rural hospitals may not do everything that a large hospital can do, but they can certainly be successful. They can certainly provide services to their community. And I'm a firm believer that the best health care needs to be provided locally because that's where, first of all, it's close to your home. So if you're in a medical emergency, you don't have time to travel 60 or 120 miles to get to a large hospital. Also, if you're convalescing in a hospital, it's really important to have your family and your friends and your church and your neighbors close by because that helps in the healing process to have those support groups there. So I think to the extent we can keep our patients local, that's great. But we've got some hospitals that do a phenomenal job in and across our state that are on call 24/7. And they'll do a great job for our patients.
Yeah, in a lot of cases, those rural hospitals are the largest employer in the.
They're going to be your largest.
Yeah, one of the largest.
They are. They're going to be one of your largest employers. And look, when healthcare leaves a community, good luck trying to bring jobs back in because it's going to be really hard to locate any type of manufacturing or any other type of industry in those small towns because employers want to have access to health care for their employees. And if you're a family looking to locate into a part of the state and you may love everything else about it, but if there's not a hospital, if there's not physicians, if there's not someone there to take care of themselves, take care of their kids, or take care of them as they grow older, when all of us start to need health care more is in the last 20 years or so of our lives. And, so you're thinking about things from terms of retirement communities. And we do a great job with attracting retirees to Mississippi. We've got good quality of life, low cost. But healthcare is a big part of that.
Richard, we covered a lot of ground today and appreciate you coming in. Anything else you'd like to mention, particularly coming up in this session or with MHA?
Yeah, so, again, I just want to say how much I appreciate our talented staff at the Mississippi Hospital Association that are serving our members. I want to say I appreciate our members and what they're doing every day to take care of all of us. Our motto at MHA is serving those who serve us all, and we're going to continue to lead with that same servant heart that MHA has been about for, like I said, almost 100 years. And that's where we're focused. And I think if we get that right from MHA's perspective and how we relate to our members and how we provide service to them so they can provide service to their patients, everything else is going to take care of itself.
Yeah, and I would just end by, saying go to our MississippiToday.org webpage, and we have a running ticker of how much the state has lost in Medicaid, lost in federal funds by not spending Medicaid, and since July 1st, it's now up to $807 million. So,
well, and I'll say this too. One of the misconceptions about Medicaid expansion is that money may go to the individual that's enrolled for Medicaid. The money does not go to that. It does not go to that. The money goes to pay the providers who are taking care of them. And that provider, is not going to stick around long if they don't have the means to maintain the quality of life that they want. And so, they've got bills to pay: the hospitals, the physicians, the nurses, the anesthesiologists, the ambulatory surgery centers, all pharmacy, all these entities that are here that we all need, whether you're on Medicaid or not. Someone is going to be accessing those services. So, folks who are enrolled in the Medicaid program simply have health insurance coverage, just like I do. And so, when I access health care coverage, I don't get a check from my insurance company. they stand in the shoes of me and they pay my physician, or they pay my pharmacist, or they pay my surgeon, and or so on. So that's really what it's about, is trying to just let folks have that ability to access care in the same way that all of us get to access it. And in the case of Medicaid expansion, it's folks who are out there working. They're just working in jobs where their employer is not able to, in many cases, pay for employer-sponsored health insurance company coverage. And so, I think we can do this in a way that reflects Mississippi core values, that reflects who we are as a state, and recognize that we need to do some things, because if we're not lifting folks up, we're going to continue to have some challenges in growing the workforce and having a healthy workforce. But most importantly, just improving the quality of life for all Mississippians, which raises the quality of life for all of us.
And then that money does turn over into the economy and creates jobs. And
it does.
That's
creates jobs. And we did
issue.
Yeah, and we did a report many years ago that shows the impact across lots of different industries. So it'd be a big help.
Richard, we appreciate you coming in. And,
thanks, Geoff. Thanks, Bobby.
Would love to keep in touch and have you back early and often, especially
you just let me know when and where. Yeah,
some
love
big
to.
issues coming
Appreciate
up.
what y'all do.
Yeah, and
thank you very much.
Happy Thanksgiving, everybody.
Yes.
Happy Thanksgiving. Very good.
Thank you, sir.
Thank you.
As we cover the biggest political stories in the state, you don't want to miss an episode of The Other Side. We'll bring you more reporting from every corner of the state, sharing the voices of Mississippians and how they are impacted by the news. So what do we need from you, the listener? We need your feedback and support. Subscribe to our weekly podcast on your favorite podcast app, or stream episodes online at MississippiToday.org/The Other Side. For the Mississippi Today team, I'm Adam Ganeshow. The Other Side is produced by Mississippi Today and engineered by Blue Sky Studios. We hope you'll join us for our next episode.